stumble to the kitchen, pour myself a cup of ambition and yawn and stretch and try to come to life.
Welcome back to Good Day. Thanks for waking up with us this morning. Stress is a topic that is constantly brought up in news, but it is for a good reason because it can affect your life in so many different ways. And now, recent studies are linking a decrease in fertility to stress. Joining us this morning is Dr. Shahryar Kavoussi, a board-certified reproductive endocrinologist who practices at St. David's South Austin Medical Center. Thank you so much for joining us today.
Thanks for having me, Scarlett.
So, this new study that came out, how did they conduct it? Let's start with that. How did they do this study?
So this study was conducted at two different sites. It was in Michigan and in Texas. So interestingly enough, one of the sites was in Texas. And the group that was doing the study actually looked at recruiting couples that were trying for pregnancy and wanted to follow them over time and also look at stress indicators and see whether those stress indicators predicted whether they get pregnant or not, or what their likelihood of pregnancy is. So they had 501 patients that were enrolled in the study, and 401 of them, so 80% of them actually completed the study and had data that was analyzed for the results. And what the researchers did was they looked at two different markers. They looked at, it's called salivary alpha amylase, which is an enzyme that's produced in the saliva, which is an indicator of chronic stress or long-term stress. They also looked at cortisol, which is an indicator of short-term stress. And they looked at whether either of those two were associated with how long it took to get pregnant or whether they got pregnant at all within 12 months. So they followed the couples for 12 months and they found some results that were pretty interesting.
That's crazy. What were some of the results? I mean, because if stress, it can affect us in so many different ways, as I mentioned at the beginning of this, and now it's affecting whether or not you can get pregnant, which I just think is crazy. So what were some of the results found in the study?
So they found that the couples that were trying for up to 12 months in this study, if they were in the upper third of patients with the upper third highest amylase levels, that basically they had a 29% reduction in what's called a fecundity, or a live birth rate per month, which translated into a longer time to pregnancy. And they also found a twofold increase in infertility. So there were a good group of them didn't get pregnant at all in that year.
So are there any ways that women can, consciously think of how they can manage their stress? Were the women that were in this study doing something different to manage their stress? So
apparently that wasn't followed, so we don't know about that. But the theories are that if you decrease the stress, that it may help optimize fertility. And as we all know, there are a lot of other factors that are much more overwhelming when it comes to infertility. If people have ovulation problems or tubal problems, if there's sperm problems among the couple, uterine problems, many different things, endometriosis, all those things, those can overpower the stress. But decreasing that stress may optimize their chances. And if they don't have those other factors, theoretically the stress coming down may help them get pregnant faster, the couples. So what you're asking about what to do to make it better, it's really hard to measure stress. And this is a good study, but there are a lot of other things that can be measured too to measure stress. And how do you treat that stress? These are things that are a little bit more nebulous, but it's thought that things like yoga and meditation may help. So that was even mentioned in the study, that these kind of activities may help decrease stress.
Okay, and maybe it depends on the person too. If you know something that you do, that decreases your stress, whether it's reading or yoga or exercising, I think it's probably figuring out the right tool for you, but it's just knowing consciously that it can affect your fertility. So, with this new recent study out, we wanted to let you guys know and that it's important to consider, when you're trying to reproduce. So thank you, doctor, for joining us this morning.
Thank you again. Appreciate it, Scarlett.
Awesome. Yeah, and if you want to learn more information, you can obviously visit St. David's Medical Center's website or go to myfoxaustin.com. But that is what we have for you right now. Thank you so much.
Thank you again.